Chapter 4. Understanding the Body. Doctors have to understand how the body works so that they can make people well. Understanding the body also helps doctors to cure more diseases. Looking inside the body. Early doctors were not allowed to cut open dead people to look inside their body. An ancient Roman doctor called Galen learned some things by dissecting animals, but he made mistakes. He thought a person's jaw had two bones, like a dog's jaw. From 1540, scientists started to dissect people's bodies. Leonardo da Vinci was a famous artist who dissected human bodies. He drew very clear pictures of what he saw. Helping patients. Ambroise Paré was a surgeon in France about 450 years ago. At this time, many patients died after surgery because they lost a lot of blood. Ambroise Paré learned to tie blood vessels after he cut off a wounded hand, arm, or leg. This stopped patients bleeding too much, and it stopped many of them dying. Ambroise Paré also made the first artificial hands, arms, and legs for patients. He wrote books about his ideas. These books helped other surgeons to become better at their jobs. How the heart works. In Egypt about 760 years ago, a famous doctor called Ibn al-Nafis studied the heart. He discovered that it moves blood around the body. He also discovered that blood travels from one side of the heart to the other side by moving through the lungs. In the lungs, the blood mixes with air. Blood leaves the heart through blood vessels called arteries, and it travels back to the heart through blood vessels called veins. In 1628, a British scientist called William Harvey wrote a book about this.
Discover!
There are about 160,000 kilometers of blood vessels in the body. Microscopes. A microscope is a machine that magnifies very small things. It makes them look bigger so that people can see them. In about 1640, scientists started to use microscopes to learn about the body. A Dutch scientist called Anton van Leeuwenhoek saw capillaries through a microscope. Capillaries are tiny blood vessels that connect arteries and veins. Anton van Leeuwenhoek also used his microscope to look at some plaque that he took from between his teeth. He was surprised to see tiny living things in it. These tiny living things were bacteria. Many years later, doctors understood that some bacteria could make people ill.